Carpal tunnel syndrome is noticed more by people that use their hands for activities such as typing or writing or playing instruments, which is near and dear to my heart. They can notice these symptoms maybe more because they're using their fine motor skills to a higher extent than someone that maybe doesn't do these activities as frequently. I'm Dr. Shulman. I am an orthopedic surgeon with a special interest in hand and upper extremity surgery as well as traumatic injuries throughout the body. What carpal tunnel syndrome is a compression of the median nerve as it passes through the carpal tunnel. And what the carpal tunnel is an area of the wrist that is basically an enclosed space. And the contents of the carpal tunnel are many of our flexor tendons that allow us to move our fingers, but also the median nerve. And the median nerve provides sensation to our thumb, index, middle, and part of our ring finger, and also this group of muscles here that controls our thumb function. When the median nerve becomes compressed as it passes through the carpal tunnel, it doesn't pass its signals as quickly. And by not passing its signals as quickly, patients get pain in their hand, pain in their fingers, numbness in the fingers that we just spoke about, and if the symptoms become very severe and the problem is not treated, the signal to this muscle group can actually decrease to the point where that muscle can wither away, and that's an end-stage problem of carpal tunnel syndrome that we only see in the most severe cases. Patients with mild symptoms that don't have a traumatic injury that just may have developed carpal tunnel over a short period of time can also have resolution of their symptoms over a period of weeks to months. There are a few things that we can do to help alleviate these symptoms without doing surgery. The most common is what we refer to as night splinting. The carpal tunnel often becomes exacerbated at night, and one of the most common complaints that we hear from patients with carpal tunnel syndrome is that they wake up with burning pain in their hand or in their fingers. They feel like they have to shake their hand in the morning in order to get it to wake up. What we often do when we're sleeping is we sleep in almost a fetal position with our arms curled or our arm curled under our head, and this causes a fair amount of wrist flexion, which closes down the space in the carpal tunnel and makes it more difficult for our median nerve to pass these signals. So night splints can be extremely helpful because unbeknownst to us when we're sleeping, our wrist stays in a more neutral position, those signals can pass better through the median nerve, and the inflammation that surrounds the nerve by not getting its signals can resolve, and oftentimes this can help patients resolve their symptoms or keep their symptoms of carpal tunnel at a low enough level where they're comfortable living their daily lives.